There are really only 3 areas in the state of Mississippi that anyone could remotely call urban. The rest of the state is rural. It's just that simple.
Jackson, it's the capital city of the state of Mississippi. It's the largest metropolitan area. Jackson's got a lot to offer, including our medical system here.
We do have a very large population that does not have all the resources they need. So a drive to Jackson would be a burden for them.
Almost every one of the 82 counties are designated as health professional shortage areas by the federal agency HRSA. Almost 40% of our population has hypertension, almost 13% has diabetes.
Telehealth can pose some hope for those patients who are living in those rural areas and who really have a desire to prevent complications, but also to manage those conditions as they already exist.
That's why programs like ours and the Center for Telehealth try to reach out to those people that live in areas that are more difficult to access care and provide those services they need.
The beginnings of telehealth at UMMC started with the Telemergency program. It was truly birthed out of a need, like a real need. We set up a program at that time where we could train the community providers, we could train nurse practitioners who are from that community. Our physicians, in particular, become collaborators for them. So it's like having extensions of our board-certified providers in those communities.
We have created a collaborative program from not only the Center for Telehealth, but we work together with specialists in Department of Cardiology, endocrinology, pulmonology, to actually set up some of these innovative programs.
If it were just me or one other person trying to do this alone, we wouldn't be able to reach as many patients. And so that multidisciplinary team-based care model allows us to do that more effectively.
RPM, or remote patient monitoring, allows us to extend care beyond the hospital walls.
Patients are enrolled by their provider. And so when the provider identifies the patient as a good candidate for the program, then optimally they would introduce and discuss the program with the patient.
We give you a device and a blood pressure cuff, and all your blood pressure readings are automatically transmitted to the telehealth center. So I think this would benefit you greatly, ma'am.
So after we determine that the patient is ready for enrollment, then we order the equipment to be shipped to the patient's home. Once the equipment is received, our support team then calls the patient to do an onboarding or installation call.
Hi, Ms. Jones. This is Cindy calling from University of Mississippi Medical Center.
Not every patient is savvy in using digital devices. Educating the patients on how to use those devices properly can go a long way in having them engaged with your program.
All right, it's time to check your blood pressure. If you will, tap the button on your blood pressure monitor. Well, I'd like for you to practice over the next couple of days, and I will call you back in 2 days as well.
If the nurse who is monitoring the patient notices anything that is troubling, like the blood pressure is too high or too low, then she'll initiate contact with the patient to make sure that everything is okay and assist with any sort of potential emergency if that is the case. But if not, then do an assessment to help determine why that blood pressure might be that high or that low.
We want to make sure the blood pressure that we receive are the most accurate, because some things can affect your blood pressure reading.
By bringing a pharmacy into the team, working under a collaborative practice agreement, the pharmacist is able to directly manage the patient's medications and change them in real time instead of delaying care until the in-person visit.
For health systems that are trying to implement RPM, my advice would be that, number one, pay very good attention to buy-in, but not only from providers, buy-in from the patients as well should be the focus, because in the end, that is, you are driving care and improving care for the patients.
Of course, folks need to refer their patients to our program, and so a big part of this is getting the word out about what the program is. So over the years, we've had various meetings with different departments and divisions, sitting down with them, explaining what our program is, what providers can expect, what patients can expect. The other thing that's been really important that we've implemented recently is we've been giving referring providers feedback on how their patients are doing on the program. So that allows them to keep the program top of mind, lets them know their patients are experiencing benefit from being on the program, and can facilitate referrals that way.
Reminding the providers that we're here, touching base with them and pinging them, but then providing education too about which patients are best patients for us.
Within the past 3 years, we've had the opportunity to collaborate with the American Heart Association Center for Telehealth, and this has been a great initiative for our program. It really allowed us to take a step back and reevaluate where our program is today. With our RPM program for hypertension, we found that patients that were enrolled in the remote patient monitoring program saw significant reductions in both systolic and diastolic blood pressure compared to those patients that were receiving usual in-clinic care only.